అంటే మా ఫాదర్‌ని నేను ఇంట్రొడ్యూస్ చేశాను.
That is a nice gesture, na?
So, okay, it gives me a lot of happiness and I can't find the words and fear at the same time. ఏంటి భయంతో కూడిన భయం. Probably one of the first few vascular surgeons of India.
I think that was a scenario in those days, na?
Yeah.
People were a little afraid to make these professions as mainstream.
Then actually when I told him that I want to become a vascular surgeon, he was of opinion that most of the vascular surgery practice is about amputations and not preventing one.
People used to joke, vascular surgeons, what you do?
అంటే మా ఫాదర్‌ని నేను ఇంట్రొడ్యూస్ చేశాను.
That is a nice gesture, na?
Okay. So, okay, it gives me a lot of happiness and I can't find the words and fear at the same time. ఏంటి భయంతో కూడిన భయం. Or some.
Gaurav.
So, he doesn't need an introduction, but we have Dr. Pinjala Ramakrishna with us, probably one of the first few vascular surgeons of India. He has been a vascular surgeon for almost about 40 years now, 45 years. So I will not ask him the question, why did he become a vascular surgeon? I want to know that why did, what would you have done differently if not a vascular surgeon?
Yeah, of course. Cardiothoracic surgery, vascular surgery, plastic surgery, and vascular surgery. All three branches attracted me. But at that time, one is very often associated with mortality, cardiac surgery. So the cardiac surgeons used to do vascular surgery also. I thought it is better to have less mortality, better patient acceptance, and little harm to the patient compared to the cardiac surgery. Plastic surgery, very attractive to me, but there was no thrill of clamping the blood vessel, releasing the blood vessel. So I thought plastic surgery is a standby. But trauma, orthopedics, vascular surgery is another area where I wanted to do. But again, that was not the popular brand at the time. So I am left with vascular surgery by choice, not by exclusion. So I like vascular surgery also much more than the other branches. So that's how it goes.
Okay. And then, but if not a doctor at all, what would you have become? Nobody would have asked you this.
No, that way it was imprinted in my mind that I should become a doctor and a surgeon and especially a heart surgeon. That was my grandfather's wish. So I took it up.
But-
Plus, plastic vascular surgeon Khanna, S.K. Khanna was my teacher. He was also fascinated by vascular surgery and he started as vascular surgeon in PGA Chandigarh. So that's how I got I'm imbibed with the principles of Dr. S.K. Khanna, who was my teacher.
But you're so good at writing. I mean, didn't you ever want to be an author? You're so good at painting. Didn't you ever want to become an artist? You play badminton so well. You could have been an athlete.
Athlete, I don't think. But definitely the other possibility is painter. I used to have a lot of interest in painting, line diagrams, which are very useful to my practice, and color paintings, glass painting. I used to do painting on the glass. So many things I tried, but they were only supplementary. They are not the mainstream for me.
I think that was a scenario in those days, na?
Yeah.
People were a little afraid to make these professions as
Yes.
mainstream.
Yes.
Correct.
So, wow.
So from days when vascular surgeons per se were seen as more of amputation surgeons, because one senior general surgeon actually, when I told him that I want to become a vascular surgeon, he was of opinion that most of the vascular surgery practice is about amputations and not preventing one. How do you think that the days have changed in the surgeon's point of view, or surgeon's perspective?
People used to joke, vascular surgeons, what you do? You do either prepone the amputation or postpone the amputation. Your life is with amputation. So we disproved that by saying that, look here, I have patients coming to me after 25 years with limb on and life extended. So both are important for us. The life of the person, limb of the person, longevity of living, longevity of walking on their own feet. So I think it's very fascinating.
So, how do you see the change that patients have become? Like you might have seen patients who used to come to you from far off with no Google or not even a landline or a cell phone access. They used to, search for you, come, and they actually literally treated doctors as gods. From those days, you also are seeing patients from the Gen Z where they're loaded with information, with everything available to them on Chat GPT or Google. They come, they see ratings for a doctor on Google and come to you. I've seen a quite a journey.
Correct.
So, what transition do you see in patients and how do you perceive that?
ఇప్పుడు మనం చూసే తెలుగు ఆడియన్స్ వస్తుంది. ఒకప్పుడు మీ ఎంబీబీఎస్ టైమ్స్ కావచ్చు, దాని ముందు జనరేషన్ కావచ్చు, నాడి చూసి అన్నీ చెప్పేస్తారు. నాడి చూసి ట్రీట్మెంట్ అయిపోతుంది. అసలు డాక్టర్ చేయబట్టుకున్న సగం నయమైపోతుంది అనే స్టేజ్ నుంచి ద కరెంట్ సిచ్యువేషన్ లైక్ దే గూగుల్ ఇట్, దే అసెస్, చాట్ జీపీటీలో పెడతారు, లేదంటే విండో షాపింగ్ అవుతుంది. సో ఈ టైప్ ఆఫ్ వర్క్ కల్చర్లో సో
What is your perception?
వాట్ ఈస్ యువర్ పర్సెప్షన్?
If you sit in my clinic, you get to see patients who are 30 years follow-up, 25 years follow-up, with limb on and with the carotids intact. So I contributed to the vascular surgery by medical management. Patients should be given least trauma and least expensive. But the things have changed now. Now you should do better things than what we have done 20, 30 years back. Because 20, 30 years back, the cath labs were not there, ultrasound machines were not there, and patients, as you said, coming far off places, they don't have accommodation. So there were basic problems, but we could overcome it with the help of the government, because I worked in the government setup for the past 35 years or so. So this is essential to help the patients who are coming from far off places. What I found is you need to talk to the patient.
Yes.
Whatever you do procedure, we should talk to the patient, explain them, and that will relieve a lot of their pain and discomfort and all the troubles that they face when they come to the hospital. But those things will be addressed as the time passes, and we had contact with the local hotels for a day care stay around NIMS. So that gave them a lot of confidence that doctor is looking after not only for our stay in the hospital, but also in the outside the hospital.
So I think we need to learn from
Learn
this
from
and
Uh,
plan things
Yeah,
for patient
patients.
accordingly.
But do you think it's we should see? I think we right now the biggest challenge we face is negative review ochindi. Not that we got. I don't think any of us got it, but I know a
Yeah.
lot
People
of
were relatively afraid to
doctors
make these
negative review
professions as
ochindi
mainstream.
ఏంటి and do you think we as a generation should be bothered about those reviews, or
Just let your work
or
do
just
the
let it be and
Let
it's
it
just
be.
part and
No,
parcel
you
of it?
should not neglect also. You should address them in the right way with the right people around you, and not to tell the wrong things, not to bluff, not to not to halde namaskar. So we must address it when the time comes to be addressed.
There's one question I always wanted to ask you, sir. I think it's about ethics. So, మనకు నచ్చినా నచ్చకపోయినా we know even several of our colleagues whom we know in person, they do unnecessary surgeries, unnecessary propaganda, create fear among patients. I'm sure throughout your journey, there might have been temptations of money, fame, and several other things. So, how could you keep your integrity by not falling into the trap of going after money or fame or whatever? And why is that some people, tend to go there despite being, working hard throughout their MBBS, they are coming from humble backgrounds. How do they become prey to that? And how do you keep yourself from not falling prey to it?
And especially your career spanning over decades.
I would say that my career is this way because of the support provided by my family. I don't think I would have done this without the family support. So I never looked at the bank account.
Yeah.
You never did or you never had to?
Both. A bit of both.
So I think it never can be both because there is no upper ceiling. As sir rightly said, you having your integrity and the people surrounding you let you maintain it. Because if you have 10 crores, if your
11th
it-
crore is
your family can just tell ki this is not enough, or you might feel it this is not enough. There is no upper ceiling. Ambani can still think there is a lot for me to do, not only in the terms of overall achievements, in the absolute figure of money.
money.
So you
So what
need,
is your take on this?
అండ్ ఐ థింక్ మనం ఎప్పుడు కూడా ఖర్చు ఎంత అవుతుంది, బెనిఫిట్ ఎంత వస్తుంది పేషెంట్కి, ఎంత సఫరింగ్ ఉంది, మళ్ళీ ఈ పాడైపోయిన భాగం బాగు చేసేది మళ్ళీ పాడైపోయే అవకాశం ఉందా, రక్తనాళాలు మళ్ళీ 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 పాడైపోతుంటాయా, మరి కొత్త రక్తనాళాలు ఉపయోగం ఏంటి అని సమయం, ఖర్చు, ఉండే విధానం, ఈ 3 అడుగుతారు పేషెంట్స్. అది తక్కువ ధరలో అవ్వాలి, అది తక్కువ టైంలో కావాలి, పేషెంట్కి ఉన్న ట్రబుల్ పూర్తిగా నయమైపోవాలి, మళ్ళీ మళ్ళీ ప్రాబ్లం రాకుండా ఉండాలి. ఇలాంటి చిన్న చిన్న పాయింట్స్ పెట్టుకుంటే యూ విల్ బి డూయింగ్ ది బెస్ట్ ఫర్ ది పేషెంట్.
బట్ ఇప్పుడు మీరు చెప్పిన పాయింట్లో సార్, ఇన్ ప్రాక్టికాలిటీ దెర్ ఆర్ లాట్ ఆఫ్ టైమ్స్ వేర్ వీ కాంట్ బ్యాలెన్స్ ఆల్ దీస్ థింగ్స్. లైక్ యాంజియోప్లాస్టీ అయిపోయిన తర్వాత యాజ్ ఎ డాక్టర్ వీ నో దట్ ప్రస్తుతానికి ఉన్న క్రైసిస్ నుంచి మనం ఈ కాల్ని లేదంటే ఆ పర్టికులర్ లిమ్ని దాటవేసాం. వాళ్ళు దాన్ని జాగ్రత్తగా చూసుకోవాలి. బట్ అట్ ద సేమ్ టైం డిపెండింగ్ ఆన్ దేర్ ఓన్ థాట్ ప్రాసెస్ ఆర్ దేర్ అవేర్నెస్, జనాలు చాలామంది ఏమనుకుంటారంటే అప్పుడు ఆపరేషన్ అయిపోయింది కాబట్టి ఇంక ఈ కాలు నయం అయిపోయింది. సో హౌ టు బ్యాలెన్స్,
క్యూర్ అయిపోయింది అంటారు.
క్యూర్ అయిపోయింది అనుకుంటారు. సో హౌ టు పుట్ దట్ పర్స్పెక్టివ్ ఇన్ టు దెమ్.
For that reason, we need to keep the brochures. I was fascinated by the way Germans tell their patients. They have excellent discharge record, and at the time of admission, they are given a sheet brochure, and they are asked to return the consent form after 1 week. Giving the paper around, then asking them after 15 minutes is not right.
The consent
Okay.
so
Okay.
that they go through it
Through and understand completely. Take that time.
Take their time. We should not rush. Patient can get apprehended if you rush them. Because of various reasons, the operation theatre time, other staff availability, sometimes we may be postponing, sometimes we may be preponing. So అందువల్ల patients are the people who decide what is to be done and what.
Your training abroad impact you? Was that useful? In what way? Or do you think it's necessary for all of us to go spend some time abroad, look at the systems and come back practicing it?
మంచిదే, అలా జరిగితే అవకాశం దొరికితే చేసుకోవడం, నేర్చుకోవడం, ఇంకో హాస్పిటల్లో ఇన్ ద అదర్ కంట్రీస్లో వెళ్ళచ్చు. బట్ డోంట్ అండర్ ఎస్టిమేట్ వాట్ వీ క్యాన్ డూ హియర్. అదే శ్రద్ధతో ఇక్కడ కూడా మనం చేయొచ్చు. మేమందరం ఆల్రెడీ చేసి చూపించాము. యంగర్ జనరేషన్కి ఇంకా బెటర్ ఆపర్చునిటీస్ వచ్చినాయి. ఇప్పుడు అల్ట్రాసౌండ్ మెషిన్, క్యాత్ ల్యాబ్ బికమ్ కామన్ ఇన్ ఎవ్రీ హాస్పిటల్ యూనిట్స్. అలానే ఎక్స్పెండిచర్ కూడా జాగ్రత్త చూసుకోవాలి. ఎక్స్పెండిచర్ వీలైనంత తక్కువలో అవ్వాలని అడుగుతాడు పేషెంట్. ఆ ఎక్స్పెండిచర్ గురించి ముందు చెప్తే బాగుంటుంది.
Sir, you're a lot into your scientific publication, writing papers and all. So what is your comment on what is called as industry-driven research, industry-driven publications? How is that impacting healthcare? Or how is it that impacting the healthcare costs and procedures as such?
అంటే ఇండస్ట్రీ డ్రివెన్ దాన్ని చెడ్డదని అనుకోవడానికి వీల్లేదు. వీ హ్యావ్ అదర్ బిగ్ ఆర్గనైజేషన్స్ లైక్ Indian government organizations and foreign governmental organizations keeping track of all the research. So when we do research, we have many responsibilities. The records are kept for 12 to 20 years. And if necessary, second half of the research will be done 1 and 2, like Einstein 1, Einstein 2. So the trials are also becoming more stringent. So అలానే రీసెర్చ్ని మరి తెలుగుకి తీసుకోకూడదు. కొంతమంది రాంగ్ రిపోర్ట్స్ ఇస్తున్నారు.
Yeah, exactly.
Yeah.
సో అందువల్ల ప్రజల్లో నమ్మకం తగ్గింది. సో ఆ నమ్మకాన్ని మనం పెంపొందించాలి అంటే స్ట్రిక్ట్గా చేయాలి. గవర్నమెంట్ సపోర్ట్ తీసుకోవాలి. మన దగ్గర చాలా నేషనల్ ఆర్గనైజేషన్స్ ఉన్నాయి, ఫండింగ్ చేస్తారు వాళ్ళు. డిఎస్టీ ఉందనుకోండి, డిఎస్టీ దగ్గర 4 to 5 crores దాకా ఫండ్ చేయొచ్చు. సో అందువల్ల మనం ఫస్ట్ ప్రధానంగా ఏం చేయాలంటే ఏ విధమైన పరీక్షలు చేయాలి, రీసెర్చ్ పాయింట్ ఏంటి, ఒక విధంగా ఎన్ఎన్బి నేషనల్ బోర్డ్ ఆఫ్ ఎగ్జామినేషన్స్ వాళ్ళు పెట్టిన విమర్శ లేని రీసెర్చ్ చాలా ఇంపార్టెంట్. విమర్శ
Thesis and all.
థీసిస్.
Sir, you've been teaching for quite so many decades. I mean, you are teacher for all of us. You taught us. You are our examiner. So, what do you think has changed among the medical students as such from the days you started practicing medicine to now?
I think they are more apprehended by the research and competition. Young doctors have more competition because you have to prove yourself, and patients should come to you afterwards. సో అందువల్ల మేము చాలా లక్కీ పీపుల్ అని చెప్పుకోవచ్చు.
Okay.
మీకు ముందుంది చాలా ఛాంపియన్షిప్ అలా
It's
అనుభవించగలరు.
not going to be an easy path.
It's not. Yes.
You must get new ideas, new methods, new approaches. So I'm happy to see the way you are progressing.
No, I think that's the funny thing because when I started, when I finished vascular surgery and then joined as a consultant, so then I kept telling dad, marketing cheyali, ikkadiki ellali, adi cheyali. And then he's like, enduku? I mean, I'm not able to relate to what you're saying. I can't give you that much advice on it because I never did it. నేను చేయలే and I never had to do it కూడా. పేషెంట్లు నన్ను ఎత్తుక్కుంటూ వస్తారు. And I think that is the biggest gap for, sir's
Mainly
generation
what
of
has
doctors.
changed is that's what patients were coming in search of the doctor previously.
Yeah.
Now we have to go and reach the patients and tell them this is what we are, this is what we do,
I
this
mean,
is
you
what
ask
needs
him-
to be done.
Ask him if he has an Instagram account.
ఇంకోటి ఏంటంటే ఫర్ ఎగ్జాంపుల్ కన్సిడర్ ద సింపుల్ వ్యాక్సిన్ ఎగ్జాంపుల్. ప్రీవియస్లీ ఒక వ్యాక్సిన్ కొత్తది రావాలంటే యూస్ టు టేక్ డెకెడ్స్. యూ కెన్ సీ హౌ ఫాస్ట్ ద కోవిడ్ వ్యాక్సిన్ కేమ్. సో ఇప్పుడు కరెంట్ జనరేషన్ ఏమైపోయిందంటే ఫర్గెట్ అబౌట్ ద కామన్ పీపుల్. యాజ్ ఎ డాక్టర్ అండ్ ఫ్రమ్ వన్ పర్టికులర్ ప్రొఫెషన్, 6 years of MBBS, 3 years of post graduation, again 3 years of super specialty, and maybe few fellowships. Even after that, 6 months or 1 year into the practice, there will be something new coming. So we need to keep track about the technology and the new things happening.
Updated.
Correct.
So
Upgrade ourselves.
సినారియోలో ఒక కామన్ మ్యాన్కి ఒక బాడీని ట్రీట్ చేయించుకోవాలి అంటే ఏ డాక్టర్ దగ్గరికి వెళ్ళాలి? సో దట్ హ్యాస్ బికమ్ ఏ సచ్ ఎ బిగ్ క్వశ్చన్ మార్క్. సెకండ్ థింగ్, యాజ్ సార్ చెప్పినట్టు కాంపిటీషన్ ఏదైతే ఇప్పుడు ఉందో, ఆర్ జనరేషన్ దట్ ఈస్ ద హార్ష్ రియాలిటీ అండ్ వీ నీడ్ టు గో త్రూ దట్. సో ఈ కాంపిటీషన్లో కూడా ఏమైపోతుందంటే దెర్ ఆర్ లాట్ ఆఫ్ డాక్టర్స్ ఆర్ ప్లేసెస్ వేర్ వచ్చిన పేషెంట్ని రీటైన్ చేసుకోవడం ఒక దాన్ని ఉంటారు
Art.
అదొక ఆర్టో లేదంటే ఒక టార్గెట్ అయిపోతుంది.
Skill,
Rather than
yes.
art, it's
It's a
becoming
skill.
స్లోలీ ఇట్ ఈస్ టర్నింగ్ ఇట్ అన్ ఇన్సెక్యూరిటీ. అమ్మో నేను ఈ పేషెంట్ని పలానా డాక్టర్ దగ్గర రెఫర్ చేస్తే మళ్ళీ నా దగ్గర రాడు. సో దిస్ కైండ్ ఆఫ్ అట్మాస్ఫియర్ వీఆర్ ఫేసింగ్ నౌ.
Sir, as a follow up to what Manikant is saying, as a physician who's been in practice for so many years, what do you think are the 3 things that should change in healthcare system as such in our country?
అంటే ఇప్పుడు మనకు జరుగుతున్న అడ్వాన్స్మెంట్స్, మోడర్న్ వేస్ అండ్ మీన్స్, వీ ఆల్రెడీ సెడ్ వీ షుడ్ ఇంక్లూడ్ వేరియస్ అదర్ ఆస్పెక్ట్స్. వన్ ట్రీట్మెంట్ ఆపరేషన్ ఆర్ యాంజియోప్లాస్టీ ఈజ్ నాట్ సఫిషియంట్. పేషెంట్కి ఉన్న అవసరాలని చూసుకొని మనం ఏదైనా ప్లాన్ చేయాలి. ఫర్ ఎగ్జాంపుల్ రొమటాలజీ పేషెంట్స్ ఉన్నారు, రొమటాయిడ్ ఆర్థరైటిస్ పీపుల్, వాళ్ళకి వాస్కులర్ ప్రాబ్లమ్ కమ్స్. సో యూ షుడ్ వర్క్ విత్ ది కొలీగ్స్.
Teamwork.
Teamwork, collaboration between different specialties is the goal.
తర్వాత ఒకరినొకరు కామెంట్స్, ఇల్ కామెంట్స్ ఆర్ నాట్ అడ్వైస్.
I think that's such a good point.
పేషెంట్స్ కాన్ఫిడెన్స్ చెడిపోతుంది దానివల్ల. ఆ డాక్టర్ ఇలా చేశారు, ఈ డాక్టర్ ఇలా చేశారు అని చెప్తా ఉంటారు పేషెంట్స్. వీ షుడ్ నాట్ ఎంగేజ్ విత్. దానివల్ల మీరు మీ మంచితనాన్ని చెప్తున్నారు. పేషెంట్ ఈజ్ ఆల్సో హ్యాపీ దట్ డాక్టర్స్ ఆర్ వర్కింగ్ టుగెదర్ యాజ్ టీమ్. ఐ గెట్ ది బెస్ట్ సర్వీస్. సో దిస్ ఈజ్ లిటిల్ ట్రికీ థింగ్. People should know a line should be drawn. This is point I don't want to talk. Beyond this, I don't want to talk. ఆ విధంగా చేస్తే ప్రొఫెషన్ మీద రెస్పెక్ట్ వస్తుంది, ఇండివిజువల్ డాక్టర్స్ రెప్యుటేషన్ పెరుగుతుంది. ఐ థింక్ దట్ ఈస్ షుడ్ బి మెయింటైన్.
సార్ ఈ 40 years ఆఫ్ యువర్ ప్రాక్టీస్లో పర్సనల్గా కానీ ఐదర్ ప్రాక్టికల్గా కానీ ఎనీ పర్సన్ హూ హ్యాస్ ఇన్స్పైర్డ్ యూ ఆర్ హ్యాస్ బ్రాట్ అ చేంజ్ ఇన్ యువర్ పర్స్పెక్టివ్ ఐదర్ ప్రొఫెషనలీ ఆర్ పర్సనలీ?
Other than madam.
My daughter.
Other than Nikhila also.
Professionally, it's very satisfying, and patients come to you after some time that they're doing well. Quality of life improved. They come back with a relative because they are satisfied customer. Customer is most important for the satisfaction because he gets another patient.
Yeah.
Yes, we said about marketing. Our patients do marketing for us.
Yes.
So once he's satisfied, obviously he is the one who gets us more patient with the trust.
That is a major patient pool for IKIGAI as of today.
Yeah.
Personally, I feel happy because they are realizing the difficulties that I face. So because I took him through the process from day 1 to day 0 of discharge. So if you follow these two simple principles, the personal life, professional life, you will be most happy person at the end of. What was the second question?
So do you remember any particular patient?
Experience with any particular patient, either it's a serious way or fun way, whatever it is.
One patient once brought to the EMD with hematosis. That day, vascular surgeons are all sitting together and having their life moments, enjoying the evening drink. But now we can only go those without alcohol. So we should never ever entertain the patient when somebody is on the effect of alcohol.
Yeah.
It becomes more important for us in the coming years. Strictly, people are recommended not to hold the class, even in the midst of parties. This lady has ruptured abdominal aortic aneurysm in shock, and she's a teacher. She got minimal money. So we worked together with the young doctors at other kind, and we operated on her, and she survived. Aorta bypass, exclusion of the aneurysm. After 15 years, she has come back saying that she is doing well. So we were happy that she is doing well. But I said, but we should investigate any requirement is there. We did the color Doppler scanning and found out that left graft blocked. But she has no pain. Ankle pressure is 70. And she's cheerful. So one doctor in our team said, let's do the operations. So I said, we will definitely operate her if it is necessary, and it is limiting her lifestyles. So patient decided to have only medical marriage. And she is still doing well. Recently she has come. Every year she comes. And we found out that there is no need at this time to do interventions. So the patient has come, no, I have not come for the operation, sir. I wanted you to get me the government support. Then not transferring me from this school to the other school, which is far away. Now I finished the operator, sir. Now she wants me to do family problems. So I gave a letter. Before that, the doctor who was being reported to her, no, you must go. I know this is a small operation. You're faking. Yeah, so all those complaints. They said, yes, sir, let me write a letter to your doctor. He will understand what in my language. So I gave the letter. Without any second question, that patient got not transferred from that hospital to the other hospital.
I'm curious, what did you write?
I wrote the procedure.
Okay. Okay.
You better do it.
Simple actually.
Okay.
And is it?
The mother understood the gravity of what exactly she had been through.
Yeah.
So then she came with one of her relative to get a seat in orthopedics, Guruvare, fellowship. So I gave a letter to her. So Guruvare immediately did the recommendation operation. So patients were sometimes very, very.
So now we know where to go if you need a recommendation.
Same thing happened. Chiraki is my sister-in-law's school. So they were standing at the queues of patient queues. Sir, hey, come here for recommendation to the school seat.
Funny. We have 2 young sons.
So both professionally and personally, I got involved in management of patients there.
So one important thing what you said in conversation is, even though the report is showing there's a block or the angiogram is showing there's a block, it's always important that we don't go by the reports.
Yeah.
So many people keep sending us now because of WhatsApp and all these reports.
Yeah.
Sir, what is the estimate for this surgery?
Surgery.
They don't even know what surgery to be done or whether it needs to be done or not. They just want the estimate. So even in this era with so much advanced medicine and everything, at least
It is because of this era, Angonda. Okay, it is because of this era, because the transfer of information has become so easy that it's very easy for someone to just ask. Ade message of 10 మందికి పంపించుంటాడు.
True, but what I meant to say is, even in this era where we have everything available at our hands to do, still, if the patient is asymptomatic, even though there is a block, or if it is not affecting their lifestyle in any way, then it's always better to manage it medically or
I think here I can really stand up for the radiologist when they say correlate.
Clinically.
Makes sense.
Yeah.
So దీంట్లో as sir said, now I can relate to one more example in my life. సో నేను ఎంసీహెచ్ చేసేప్పుడు నా ఎంసీహెచ్ గైడ్, సో ఐ థింక్ మీ కాంటెంపరీ అయి ఉండొచ్చు సార్ ఆయన కూడా, సమ్వేర్ ఇన్ అండ్ అరౌండ్. సో ఆయన ఎప్పుడు సర్జరీకి వాష్ అయ్యేప్పుడు బ్లూటూత్ పెట్టుకునేవారు కాదు, because he's a very senior surgeon, well sought out. So there will be continuous calls. ఇప్పుడు మేము ఈ 5-6 years of maybe 7 years of maximum private practice, మా ఫోనే మోగుతూ ఉంటుంది. సో అలాంటిది ఆయన ఫోన్ మోగుతూ ఉంటుంది, ఆయన ఎప్పుడు ఇయర్ ఫోన్ పెట్టుకోరు. అండ్ జస్ట్ అవుట్ గైడ్ కాబట్టి ఐ వాజ్ ఫ్రైటెండ్. ఇట్ టుక్ మీ 1 year to gather that courage and ask him this question. సో అడిగితే ఆయన సింపుల్గా నాకు చెప్పిన ఆన్సర్ ఏంటి అంటే, see, one, you are doing a surgery. So no deviation should be there when you are operating. That is a basic rule. Second thing, if at all there is an call coming from, for say, some patient, okay, one, if it is elective, it's not worth answering the call. If it is emergency, you're already in a surgery, you can't do anything. So then what is the point of answering those calls? Leave it at that. Be present in your surgery, give your best here, let someone handle. ఎమర్జెన్సీ అయితే వాళ్ళ ఈ హాస్పిటల్కో దగ్గరలో ఇంకో హాస్పిటల్కో ఈఆర్కి వెళ్తారు, అక్కడి నుంచి కాల్ వస్తుంది, దెన్ యూ కెన్ గైడ్ ద మెడికల్ టీమ్. ఎలక్టివ్గా వాళ్ళే అవుతారు, నువ్వు ఫ్రీ అయిన తర్వాత చూసి కాల్ రిప్లై అవ్వచ్చు. సో ఐ థింక్ దట్ జనరేషన్, వన్, దే హ్యాడ్ దట్ క్లారిటీ. సెకండ్, దెర్ వాజ్ నో too much overflow of information or too much accessibility to the doctor. Doctor accessibility important, but too much access also is not good. Like for example, ఒక పేషెంట్ బయలుదేరి, సార్ నేను బయలుదేరా మీరు ఉన్నారా, సిగ్నల్ దగ్గర ఉన్నా మీరు ఉన్నారా, పార్కింగ్లో కార్ పార్క్ చేస్తున్నా మీరు పైనే ఉన్నారా. సో ఐఎమ్ నాట్ సెయింగ్ ఎవ్రీ పేషెంట్ విల్ బి లైక్ దట్, బట్ దేర్ ఆర్ సినారియో
like that. Still,
No, but that's true though, because I think whether it's sir also, throughout the day, he'll get, sir, మేము గుర్తున్నామా సార్, it's like నేను 1,00,000 మంది పేషెంట్లను చూసాను. But I think they want us to remember them. We try our best. We really do try our best, but I think it does become difficult also.
And as a surgeons, when we put a knife on a patient, we become a part of their life.
Yes.
Okay?
And one more thing is,
Trained with that.
you might not recollect the name, but you recollect your wound and your scar.
100%. I agree.